Thank you for viewing this innovation vlog brought to you by the Prosecutors Center for Excellence. My name is Sophia Roach, and I am joined today with the Director of Prevention and Intervention Services for the San Diego County District Attorney's Office, Grace Liu. She's here today to tell us about their innovative community center. Grace, first off, can you talk to us a little bit about the population of San Diego, size of the District Attorney's Office?
Yeah, so San Diego County, we have about 3.3 million people, and the District Attorney's Office has about 1,000 employees, and we have about 300 prosecutors, and then the rest are administrative and support staff, investigators, paralegals, and basically, everyone is a valuable member, and we keep it all, running here in San Diego County.
And tell us, what is the CARE Center, this community center that you're here to talk about?
Yeah, so the CARE Center, CARE stands for Community Action Resource Engagement, and we are a community satellite office of the District Attorney's Office out in a community where we're right on the cusp of National City and southeastern San Diego. And so we really chose the location very specifically, looking at number of parolees, probationers, looking at the number of 211 phone calls, homelessness, just a lot of those issues that we know are related to the criminal justice system. And so we came out to the community about 2 years before our opening, and stakeholders, and they told us what they wanted to see in the community, which was a good referral service or a referral process and nice meeting spaces. And so that's really what we do here at the CARE Center.
Now, I've popped up a slide here. Can you tell us a little bit about the service referral slide and what it means for the work that you do specifically at the center?
Yeah, so what we heard from the community, especially our community-based organizations and grassroots orgs, was that, sometimes they get these service referrals and it's not the right participant for their program. And so then what ends up happening is they have to re-refer them somewhere else. And so it's just a lot of, it's not good for the participant, it's not good for the orgs. And so we developed an evidence-based needs assessment with UCSD, one of our universities here in San Diego. And with this needs assessment, we determine what their top 3 needs are using motivational interviewing and trauma-informed care to get to the top 3 needs, and then we refer them to services in the community. When we first started, we had a voucher process, which was really impactful because it was a way for us to partner with these grassroots community-based organizations that had never had a county contract before. And we were able to pay them for these service referrals like employment or housing, clothing, food, mental health care, family mediation. These are all examples of services that we refer folks to.
Now, can you tell us a little bit about how the center itself self-staffed?
Yeah, absolutely. So as you can see in this slide, we are very diverse. It's very important to me that our staff looks like the community that we're serving. And I would say even most of the folks on our team are from this neighborhood. Like I live just down the street here, and some of our folks were in our youth advisory board at a high school that we were at nearby, and now they're full-time staff. And so it's really important that we represent the community. We have Spanish speaking individuals on our team. We have folks that have college degrees, do not have college degrees, have lived experiences. We all come from varying backgrounds. And that's really important because depending on who walks in that door, someone different may connect with that person depending on, what experiences they have. But I think the most important thing, the really foundational thing that we all value is just that cultural responsivity and cultural humility. So understanding that, we have our different backgrounds, but we don't know everything. And so just to really come in with that humility is really important to us too.
Now, beyond some of the services that we talked about in the slide before, is it fair to say that your employees are also actively out in the community giving presentations on a wide variety of subjects?
Absolutely. So we partner a lot with the schools and do public safety talks. So right now we're partnered with the National School District, and we'll invite different prosecutors from our team to give presentations about, teen dating violence or fentanyl, different issues, internet safety, different issues that could affect the students at the schools. We also, our team members are very active in the community, going to different collaborative meetings and different just community meetings to really learn what the community is saying that they need. They really serve as a liaison between the community and the office. So the office can learn how to, make a bigger impact.
And you actually even have some special designees for groups such as veterans. Is that right?
Yeah, absolutely. So right now we don't, but we have in the past where we had the Veterans Empowerment Program. So we had, AmeriCorps Vista members that worked with incarcerated veterans up at the veterans module at one of our jails here in San Diego County, where they have a specialized housing unit within the jails for our incarcerated veterans. A widely successful program just because of that focus and attention that they get, and they help develop that reentry process for them.
Now, you mentioned AmeriCorps Vista volunteers, and that's an important part of the San Diego care evolution. Talk a little bit about that, and specifically keeping in mind that some of the jurisdictions that may be hearing this aren't going to have the resources of a big city like San Diego or a big county.
Yeah, absolutely. So I would say our whole division started with one full-time employee at the DA's office and one AmeriCorps Vista member. And that one AmeriCorps Vista member was me back in 2006. And AmeriCorps Vista stands for Volunteers in Service to America. And the whole program, it's like the Peace Corps, but domestic. And the whole goal is to work on projects that alleviate poverty, with two very specific goals in mind, being capacity building and sustainability. So when I was first hired on as an AmeriCorps Vista, I was working on the first comprehensive prisoner reentry program in the state of California that the San Diego County District Attorney's Office was heading with the Senate bill, and we were really collaborating a lot of that multidisciplinary effort. But since then, we have also had AmeriCorps Vista members work on our veterans programs, work on a human trafficking prevention toolkit, and just different programs that the DA's office has been able to do. And what you get essentially is you apply for a grant, and then you get an AmeriCorps Vista member. So you get staffing in the form of this grant. And I think it's great because a lot of the AmeriCorps Vistas, you're getting someone who has a passion and heart to help people. And you get people who may have a college degree, may not, but have, great life experiences, or they just add a lot of value, I think, and different perspectives to the office. And we've had such a positive experience with AmeriCorps.
Now, during the pandemic, is it fair to say that in addition to providing references for services, that you also became a hub, a distribution point for people in the community?
Absolutely. The community was letting us know that there was just such food insecurity as people were losing their jobs or losing their homes. And so we just pivoted and became a food distribution site. So we were distributing food weekly, and we were really targeting even the population because, during the pandemic, there were so many food drives, and a lot of our local agencies like the San Diego Food Bank and Feeding San Diego stepped up in those ways, which was great in a lot of our faith-based communities. But some of our folks in the community had transportation barriers, or they were people with childcare barriers. So for example, we have this group that we work with where it's grandparents raising children. And so they couldn't really go to these food drives to pick up the food because they're taking care of the children. And so what we had was we would partner with our community-based organizations that work with these populations that have these special needs, and they were picking up the food and then delivering the food to these families. And so we really were able to kind of, I think, fill a gap that came up during the pandemic that wasn't really being addressed by, any other org. So we feel very proud about that.
Now, the care center, I see you've got a picture here of several care center employees along with your district attorney. How important is that partnership with attorneys and care center employees within the office? What have you seen the benefits to be?
Yeah, absolutely. I mean, we're so grateful, to have the support of our DA, Summer Steffen. And when she shows up at our events and, interacts directly with our community-based organizations and with the community members that attend our events, I think it's really valuable, and it sends a positive message to the community that, she cares, that the office cares. And I think that's important for a community that oftentimes feels more, hurt by the actions of our office because maybe one of their family members was incarcerated or prosecuted, or, maybe they were a victim in the past and they did receive support, but then, it's not long-term support. And so there's a lot of, hurt that can be experienced and therefore some feelings towards our office. But when, summer comes out here or when our prosecutors come out here and have that positive interaction, I think it's really important.
And so tell us, what advice do you have for offices that might be interested in adopting a care center model or starting maybe a smaller version of a project like this?
Yeah, I think my number one advice is to start meeting with the community and hear their input. I think with our division, we don't do very much without the community input. And I think that's why we have been so successful and so impactful and always had that community support, because we are really guided by their voices and what they told us that they wanted to see in this community center is what we have delivered. And so I think hearing directly from the community, knowing that, of course, there's always going to be research, and we did all that too, to know, what are the top needs, or what we use the risk needs responsivity model, which is evidence-based, and we kind of applied it to a community level. But instead of going in there saying, hey, we have all this research and this is what we're going to do, we listened to them, we heard it, and guess what? It really aligns, because the community knows what they're talking about too. And so just to really value that opinion and perspective and to work collaboratively, I think has been really has made us stronger. It's a lot of work. It's much easier to just go in and because we know what works, what doesn't, and just do the work. But I think doing it together with the community has made us much, much stronger.
Well, I want to thank you for sharing this innovation with us, and thank you to our viewers. If you would like to share an innovation, please contact PCE directly at contactpce@pcinc.org. And just in case you missed it, there is the email address there. Thank you very much.
Thank you.